Hello everyone, I am Dr. Santosh, consultant nephrologist and transplant physician at Jaidev Memorial Rashtrotana Hospital, RR Nagar. This hospital is a state-of-the-art multi-speciality setup located in RR Nagar, presently functioning at 150 beds. This hospital has fully functioning dialysis unit, ICU services and emergency services. The main motto of the hospital is to provide comprehensive nephrology services and quality and affordable dialysis at 1500 rupees per dialysis session. Our dialysis unit is fully functioning with well trained, qualified, and experienced dialysis staff and technicians. Our dialysis unit has about 8 dialysis stations. We also have provision for emergency dialysis and 24/7 ICU services also. Today, I am going to brief about hemodialysis and some of the commonly asked questions related to hemodialysis. So the first one is, what is hemodialysis? So this is a process of blood purification system. It's also called as artificial kidney, where the blood circulates through the machine, goes through the filter, and it purifies the blood along with the removal of waste chemicals and returns the blood back to the patient. So when is this hemodialysis needed? So we do dialysis for acute kidney problems and chronic kidney problems. So today I am going to tell only about chronic kidney conditions. So there are multiple causes for chronic kidney disease. We have different stages of chronic kidney diseases. Hemodialysis is one of the treatment modality which is done in a patient who reaches the final stage of kidney problem, what do we call as CKD stage 5. So how does this hemodialysis work? So when the patients are suffering from kidney problems, their blood starts accumulating with lot of waste chemicals called as urea, nitrogen, excess of potassium, along with the acid accumulation. So these are some of the molecules which gets accumulated in a patients with a chronic kidney conditions, and these need to be removed during the dialysis. So during the process of dialysis, the blood is taken from the patient through an access created either a dialysis catheter or a AV fistula. The blood flows through the machine, enters the dialyzer, also called as a filter, where there will be removal of all these metabolic waste products along with removal of excess potassium, acids, and it will be replaced by bicarbonate. And once the filtration process is done, the purified blood will be returned back to the patient's body. So lot of them ask about how long will each dialysis treatment last. The standard prescription for hemodialysis is thrice a week, each dialysis session lasting for about 4 hours. There are situations where we do dialysis 4 times a week depending on the patient condition. Most of these patients will have problem with fluid restriction and salt restriction. They always have extra water accumulation in the form of pedal edema, shortness of breath. So these patients will definitely benefit with extra dialysis, that is 4 times a week. There is a possibility of doing twice a week hemodialysis also in some patients who are very much compliant with diet and fluid restrictions and who have a good residual urine output, which plays an important role in maintaining fluid and electrolyte balance. So the other common question what they ask is, do the dialysis patients need to follow a diet? Yes, diet plays an important role in managing kidney patients and patients who are on dialysis. So we generally tell them to follow fluid restriction about 800 ml to less than 1 liter per day, salt restriction of about 3 grams. They can have good amount of protein, about 1 gram per kg body weight per day, and extra precautions in the form of dietary restrictions will tell the patients if their potassium is excess to avoid potassium rich foods like fruits, juice, tender coconuts, tomatoes, potatoes, and green leafy vegetables. There are some patients who have problem with high phosphorus, so we do tell them to have phosphate restricted diet. So the other question what patients generally ask is, can dialysis patients travel? Yes, dialysis patients can travel depending on their dialysis schedules and slots. We always tell them to have a dialysis 1 day prior to the day of planned travel so that they can have 1 day gap. In certain scenarios where the patients are traveling out of station and they are staying there for about a week or a month time, we always tell them to do or continue their hemodialysis at a nearest possible center and follow the same instructions. The other question patients also ask is about, can the dialysis patients continue to work? The answer is yes. So we do see a lot of young generation of patients who are on dialysis, who are continue to work. So we sort of give them a scheduled appointment so that they can plan their work. Either they come for the dialysis in the morning, go back to the work in the afternoon, or they schedule their dialysis in the evening, finish their work in the morning and come back and do the dialysis. So in that way, we can organize the timing and schedule of dialysis for the working population. Early detection is the key and helps in retarding the progression of kidney disease. Thank you.
ರಾಷ್ಟ್ರೋತ್ಥಾನ ಆಸ್ಪತ್ರೆಯು 160 ಹಾಸಿಗೆಗಳ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಯ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಅಂದರೆ ಒಂದೇ ಸೂರಿನಡಿ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿ, ಆಯುರ್ವೇದ, ಹೋಮಿಯೋಪತಿ, ಯೋಗ ಮತ್ತು ಪ್ರಕೃತಿ ಚಿಕಿತ್ಸೆಗಳನ್ನೊಳಗೊಂಡ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಗಳು ಇಲ್ಲಿ ಲಭ್ಯವಿವೆ. ಅತ್ಯಾಧುನಿಕ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ, ಉತ್ತಮ ತಂತ್ರಜ್ಞಾನ, ತಜ್ಞ ವೈದ್ಯರು ಹಾಗೂ ಇತರ ವೈದ್ಯಕೀಯ ಸಿಬ್ಬಂದಿಗಳನ್ನು ಈ ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. 19 ಜನರಲ್ ವಾರ್ಡ್ಗಳು, 72 ಸೆಮಿ ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳು, 11 ಎಮರ್ಜೆನ್ಸಿ ವಾರ್ಡ್ಗಳು ಹಾಗೂ 17 ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳಿಂದ ಕೂಡಿದ ಸಮಗ್ರ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ ಇಲ್ಲಿ ಲಭ್ಯವಿದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಬಡ ರೋಗಿಗಳ ಬೆಂಬಲಕ್ಕಾಗಿ ದಾನಿಗಳ ಸಹಾಯದಿಂದ ನಿಧಿಯೊಂದನ್ನು ಸ್ಥಾಪಿಸುವ ಗುರಿಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಜೊತೆಗೆ ಹತ್ತಿರದ ಸ್ಲಂಗಳಿಗೆ ಹಾಗೂ ಹಳ್ಳಿಗಳಿಗೆ ಹೋಗಿ ಉಚಿತ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುವ ಯೋಜನೆಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಅರಸಿ ಬಂದವರಿಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಆರೈಕೆ ನೀಡುವುದು ಮತ್ತು ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ಚಿಕಿತ್ಸೆ ನೀಡುವುದು ಆಸ್ಪತ್ರೆಯ ಆಶಯ. ಎಲ್ಲರೂ ರೋಗಗಳಿಂದ ಮುಕ್ತವಾಗಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜ ನಿರ್ಮಾಣವಾಗಲಿ ಎನ್ನುವುದು ಆಸ್ಪತ್ರೆಯ ಉನ್ನತ ದೃಷ್ಟಿಕೋನ.